Richard, this year the American Cancer Society says it expects to see nearly 2 million new cancer cases in the United States, and more than 600,000 patients will likely die from the disease. Those numbers are certainly startling, but cancer cases are actually declining. Joining me in our Washington studio is Dr. Ashwani Rajput. He's a director of the Johns Hopkins Kimmel Cancer Center in Washington. Dr. Rajput, welcome to the program.
Thank you.
Let me begin with what many of us were asking one another in the newsroom. What is the deadliest form of cancer in the United States?
Well, it depends. There are a number of different cancers. What we would say are the most common cancers are breast, lung, colorectal, and prostate. But each cancer can be different. Some cancers can be more deadly than others, so each cancer has a problem in terms of death rate.
What about breast cancer for women? How deadly can that be?
It can be very deadly because it is the second leading cause of death in women. But it really depends on the stage of disease that the cancer is identified. So that's why it's important to diagnose the cancer early so that you have the highest chance of cure.
It's remarkable to me that after all these years, women are still losing their lives to breast cancer, doctors. So where do we stand with prevention and treatment and all that?
So that's an excellent question. What we've done, we've made some progress in diagnosing the disease earlier. So mammography and screening is important. And then healthy lifestyle is important also. There are cases where we know that obesity is linked to certain type of cancer, and even breast cancer is linked to obesity.
So nutrition, exercise, healthy living, change of lifestyle could actually make a big difference.
Yes, absolutely it does. Obesity has been linked to this cancer and others, so we need to make these changes early in childhood to address childhood obesity, and active lifestyle and moderation of diet.
What about the economic toll, doctor? Obviously, we know about the human cost. Talk a little bit about that. This costs not just the patient's money, but also the healthcare providers.
Absolutely. So the economic cost that we spend in the United States is huge, and so the cost of treating a cancer goes up exponentially as the stage is higher. For example, an early stage cancer that may be treated by an operation that does not require chemotherapy or radiation is a lot less costly than a more advanced cancer that may require all these modalities of treatment. So that economic cost is for our entire society.
And what is your message to all the people out there, people like myself, women, men, who do think about preventing cancer on this World Cancer Day? What is your message?
My message is healthy lifestyle, but it's also following the screening guidelines. For example, the mammography that we talked about for women, colonoscopy for men and women. The beautiful thing about this is that colorectal cancer is a disease that can be prevented, and it can be treated with a cure if caught early. So we need to follow the guidelines and seek treatment.
All right, we'll leave it there. Dr. Ashwani Rajput, your first time here, so welcome aboard.
Thank you. Thank you for having me.